It's a pleasure. My name is Dr. Chinwe Aferibe. I am founder at Center Youth Clinic and Consulting. I actually used to work here. This is like coming back home here at People's. Yeah. So I'm very excited to be here and great to see your faces. I'll introduce the rest of my co-presenters.
Yes. Hello, my name is Alonzo Needham. I'm a senior fourth year biochemistry honors major at UCL.
Hi y'all, I'm Alexia Feaster. I'm actually a graduate of Jackson State University, and I'm also a youth advocate with Young Americans.
And I have some of my staff members who are in the back corner there, Adriana and Alexis. You'll hear a little bit from Alexis first. So, like I said, there's a lot to cover when we talk about adolescent well visit. And I might flip into the next. It's okay. To the next slide. We've done introductions. When you think about wellness visits, we're really curious, what were you hoping to get out of this session? Because we have some learning objectives and they're all here, but like I said, it's a short time. So we want to make sure that we don't miss out like what you were hoping to get out of it. So show of hands, how many of you are students here? Trainees. Awesome, awesome. How many of you are just community members who are here to, all right. How many of you are parents or caregivers of teenagers? All right. How many of you are healthcare providers? Awesome. Any volunteers? What is one thing that you're hoping to get out of the session? One thing that you're hoping to get? Because some of the stuff you probably already know, but I'm curious if there's one thing that you're like, you know what, I'm here because I want to ... What would that be for anybody? Looking at the objectives, maybe I'll read it for you, and then you can kind of get a sense of what direction we're going to go. We're going to be talking about best practices for adolescents and young adults as it relates to preventative healthcare. We're going to review some screening tools, again, briefly review some screening tools to assess youth mental and physical health. We're going to describe the value and components of youth-friendly clinics. And then lastly, we're going to increase the awareness of direct primary care and lifestyle medicine models for adolescent healthcare. And it's a way to innovate. So with that, like I said, we can scratch all of this if you have specific things that you want us to make sure that we address. Yes.
I'm curious if you have any strategies or any unique things that you guys do to increase access or awareness of the care that you provide.
Oh, very good question. Okay. Then I might ensure that. Thank you. Anyone else? There's music playing. Is there a way to?
Yeah, I'll go with that.
Hi! This feels like a blast.
I'll tell them.
Anyone else? Any providers?
As a parent,
Yes.
I'd love to know more about how I can personally start the assessment process for my teenagers' mental health.
Okay. Start early. Preventative care. All right, cool. And from the students, any student here have any particular objectives that they want to make sure that we address? No. Okay, that's all right. So we'll stick to this and we'll make sure we address those two before we end. Format, what to expect. I'm going to talk about like the guidelines. We have our young folks here who are going to talk about perspective from the young person. What does it mean to go through a well visit? And what are some tips that they can share for us to be able to enhance that experience? So in your hands, everyone raise your hand if you have one of these. Next slide, please. The idea of the value of wellness visits kind of fits into like a car. I was driving here and in my car, there are some lights that are on my dashboard. How many of you guys have ever had like lights on, hazard lights on, or the little triangle with a little exclamation in the middle? Yeah, mine is in that. And for some folks, some will say, well, adolescents, young adults, they don't really need to be seen that frequently. They're mostly healthy. How many of you guys believe that? All right, great. Thank you. Yeah. Most of the time, some people feel like adolescents don't need to be here to be able to actually have any sort of like conversation because it's like, well, they're healthy. Can't you see them? But when I think of wellness visits, I think of the car and the hazard lights. It's an opportunity for us to kind of look at our body physically, look at our minds and say, where are the lights shining in a young person's life? Because it's hard to see it, right? So the hazard light might be there, but we don't really know what's happening under the hood of the car. So I'm gonna schedule an appointment at my dealership to be able to say, hey, what else is going on? You gotta look under the hood. So we see the value of wellness visits as a way for us to go under the hood in each young person's life to be able to assess what else is going on, what might be missing, how can we proactively prepare them for their transition to adulthood, and how can we prepare them for life in general, okay? Now, there are terminologies that we need to keep in mind. Some people hear wellness visits and they think annual well visits. They've heard routine physicals. Any other, besides those that are on here, have you guys heard of wellness visits called different things?
Mental health check-in.
Yes, mental health check-in, yes. Sports physicals, some people think sports physicals are a way to get wellness visits. You guys believe that? It's ideal, but it's not necessarily the best way because it's really focused on them being in some sort of sports activity. But wellness visits really are supposed to be more comprehensive. So health screening guidelines. Now you have this in your hand. Every state has different guidelines that they follow. There are national guidelines from the United States Preventive Services Task Force, and they have all the research and evidence related to each particular population, what has been found to be helpful to be able to screen for particular diseases. And Texas Health Steps is related to state specific, and then the CDC, the Center for Disease Control, is another guideline. There's also Bright Futures. So some people get confused and say, well, which guideline am I supposed to follow? The short answer, there's no one right one. You just pick one. Here in Texas, we use the Texas Health Steps because we use this as a more comprehensive. They pull from CDC, they pull from Bright Futures, and they pull from the USPSTF, okay? When you look at it, I want you guys to look at, let's see here, it's back and forth. In the front page, the ages are from newborn to 10. You guys see that here? And then on the other side, it's from ages 11 to 20. Okay, and to orient you in terms of like what you're looking at, if you look at the next slide, I'll go back to this in a minute. So this is where we look at what are the components and categories that we're supposed to be keeping in mind when we have young people come in for our visits. So you see the first one here is the history, nutritional screening, mental health, measurements, vision, hearing, and lab tests. Okay, so sometimes when young people are curious about like, well, why do I need to go? This is something that you can use as a reference point to be able to talk to them and have discussions, say, well, these are the things that the doctor or the provider or nurse practitioner is going to be looking at. And these are things that we need to do based on whether it's mandatory, whether it's risk-based, so whether it's required or whether it's based on the young person's activities, okay? Any questions so far? Okay. Okay, how many of you guys have seen this before? Okay, how many have not seen this before? Ah, all right. And no questions on this so far. Do you feel like it's easy to follow? No. Okay, all right, yes, questions?
I haven't gone and looked at it, but do you agree with the generalized guidelines, or do you think that they should be done every certain amount of time? Also, I don't know the criteria for it. I'm sure it's based off of mortality and like illnesses and development ages, but does it also take into consideration like socioeconomic status as well as race and ethnicity?
Yeah, it's a very good question. The true story is that yes, these guidelines need to be updated based on the evidence that we have. So in the past, there were certain recommendations that were based on what we knew then, but as we learn more information, it's important to update it. For example, how many of you guys feel that it's important to have breast screening or breast exams for young adults, for them to do self-exams? All right, so the updated guidelines is that we're not recommended to have young people do self-exams anymore. And it's kind of counter, exactly, I like your face there, it's like, huh? So, exactly, very good question. So back to what you were asking. So every period when they're doing rates of morbidity and mortality based on particular diseases, they look back and they look at studies, population studies, and they say, well, for all the people that were screened using this method, how many of them actually were able to be identified to have the disease? And so they use that, and they use that to update these guidelines. And so USPSTF said, anytime that we're having folks do these exams, unless there's a risk factor in the family, so mom, aunt, or sister have a strong breast cancer history, the average population, they don't need to do these screening exams on their own because it hasn't been found to lead to increased rates of identification for breast cancer. And it sounds counterintuitive, but that's one of the things where the guidelines and practical recommendations sometimes don't always meet, okay? Any other questions? Okay, going back to the other slide then. Going back.
So let me go back.
Yeah.
Let me stop share. One second.
So when we think about the well visits, there is the frequency of visits. The recommendation is once a year, but it also depends on what you're screening for. In general, it's once a year, but if you have folks who are in high-risk populations, whether it's with sexual activity or substance use, then the recommendation is a little bit more frequent. So it depends on what's happening with the young person. So that's with frequency. Now, mental health screening, depression is one that is recommended for universal screenings once a year. But if there's a patient who has mental health issues, then it's important to do that a little bit more frequently. Now, there are practical considerations because, like I said, there's a lot that goes on within well visits. And if you think about the timing of a visit, most times depends on your institution, how much time is allotted for these visits, okay? Have you all ever been to a well visit that lasted an hour? That was scheduled for an hour. Let me say scheduled. Scheduled for an hour. No. Oh, you?
Yeah.
Oh, sorry. I know where you're going. Yeah. 20 minutes. 20 minutes. Maybe. 30 minutes. 15 minutes. Okay. Imagine having all these questions, all these labs, all these things being done within 15 minutes for an appointment. What do you think are some of the outcomes of that? What do you think, like, just considering it? Not much, right? Yeah. Any other thoughts?
Some risks are skipped over.
Exactly. Some risks are skipped over. And somebody's gonna actually touch base on that later on in our conversation. I'm gonna pass this around because I'll talk about some of the ways that we're trying to innovate how we do these screens so that we don't have missed opportunities to be able to delve deep into under the hood, right? And most of these screenings sometimes are through questionnaires. So I'm gonna take this, I'll start here and then I'll start the other one at the back. So pass this around, so hopefully this goes, but just look at it. These are some of the questions that we ask during the visits. If you're ever wondering, you know, what are the providers talking to young people behind in other rooms or in different areas? Okay, and then so visit time, and then roles and responsibilities and follow-up. So I used to do like focus groups with youth in the community when I was going to start my clinic. And one of the first questions I would ask them is like, when you go to a healthcare clinic or a provider, what is one of the things that really bothers you? Like, what is a pet peeve of yours? And you know, one of the most common responses I had is that they would give us these questionnaires to fill out. Sometimes it's like 20 questions, sometimes it's 30 questions, sometimes it's 3 pages. And they would get to meet the provider, and guess what would happen in the provider visit? Same questions. Same questions. And so sometimes they're like, why did you make me spend all that time writing that out? Isn't somebody looking at that ahead of time, right? Or why not use that and have a follow-up discussion with me based on what I completed on the survey, okay? And other people will say, well, I filled all this out and they didn't even address any of the stuff that I filled out, right? And mind you, some of these young people are pouring their heart out in these questionnaires, right? It's maybe one question that they're being asked, but maybe that one question might be a question that is helping them figure out their identity, right? Or if there's something happening in their house, that one question could be, oh my goodness, I wonder if they know, you know? Or they're wondering, well, maybe if I respond here, then maybe I can get help. Right? So I just wanted you to kind of get a sense, and they're gonna really flesh it out a little bit more, but my role right here is to kind of set the standard and set the foundation for how the system right now is set up for well visits. And towards the end, I'm hoping that we can have a dialogue to say, well, what are the options for us to innovate? what are some options for us to think of different ways that we can get at all those, light bulbs that are flashing in our young people, but do it in a way that is relevant to them, that is meaningful to them, that also feels empowering as well too. Okay, so I'm gonna stop talking because I'll kind of close towards the end and hand over to Alonzo.
Hello, my name is Alonzo. I'm a senior at UT Austin. And before I go into my story about my experience with adolescent health, I want to talk about my background. I'm the oldest child of a single immigrant mother, meaning I'm the first generation to be born in the United States as well as to go to college. And because of that background, growing up in my adolescence, I had a lot of independence and a lot of autonomy because I had to do things myself, like take care of my siblings because my mom had to work and stuff like that. So now I'm talking about my wellness visit, specifically in high school when I was 16 years old. And I specifically made the appointment myself. I drove myself. I did all the things by myself, even the checkup after. And because like I said before, I had to do that because my mother worked. And being that I grew up playing sports, most of my wellness checks were in the form of sports physicals. So I played baseball and football, so we always have to get that checkup or that physical done before we could play. And these were very short and unengaging, in my opinion. In this specific experience, once I arrived, there was no greeting. I was met with people working at the front desk that were on their computers, not engaged, and I got no hello. And then once they paid attention to me, I got checked in, and then I had to wait 20, 30 minutes, which I felt was long, but I guess at a moderate time. Dr. Chinway told me to be quiet, to chill out. But then a medical assistant brought me back, took my vitals, my weight, height, and blood pressure. Then I waited for the provider to come in. They took me to a room and I waited for the provider to come in. Once the provider came in, and of course it's a sports physical, so I guess they were under the impression that it was just quick and easy, so that's kind of how it felt. It felt, like I said, unengaging. Once they came in, they said a brief hello, and then they went immediately to the computer, and they immediately got started with the actual physical on my body. And then once that was done, we did a questionnaire, like Chinwe was talking about earlier, and it was very, it felt very rushed, because, especially in the questionnaire part, because they were just going through questions, simply typing on the computer. There were no follow-up questions. There was no time to step back and say, why did you say yes or no to this? Or why did you say this instead of that? No extra time for that. And this created a space where I couldn't explore maybe the questions or the things I wanted to talk about, even though I knew it was sports physical, but I had questions on sexual health, about weight, because at that time I was a little bit overweight, and I wanted to figure out ways that I could manage that. And especially being that I come from a lower socioeconomic background, I feel like there were factors that were hindering me to achieve the optimal health that I wanted to at the time. But of course, I played sports, so they kind of whisked it away and gave me kind of brief advice. So now I want to move on to a comparison list of what I experienced and what I wish I had. Yes, so in this specific experience, and as well as other experiences in my adolescence, I experienced this where there was no safe space to discuss sexual development. And what I wish I had in that time was an open-minded provider that made me feel seen. By open-minded, I mean someone who engaged and talked to me with eye contact, with culturally competent language, being that I am a part of the LGBTQ community, for example. I wish I had a provider that would ask maybe separate questions or more in-depth questions regarding that, because our adolescence is sort of on a different track than heterosexual adolescence, for example. And then next, like I said before, I experienced visits where the birth questionnaire on gender sexuality was done. So I wish I had an opportunity to have deeper conversations about that. And something that I want to voice is that I hope there are advocates that push for more time to have these opportunities for these needed conversations, because simply asking questions from a list is not efficient when adolescents need support from that person in that time, being that such a vital time in growth. And that lack of communication can take away from the purpose of the patient-provider relationship that is needed at that time, and can lead to adolescents engaging in risky behaviors, like you were saying earlier. And then next, I experienced vague explanations on how to engage in safe practices. So I wish I had providers that gave me clear communication, but also practical guidance, something actual, something tangible that I can use rather than just a general advice tool. So because if there's no action, communicating alone will not be meaningful and can feed back into the cycle of experiencing that vagueness in communication, and then of course lead to risky behaviors possibly being done. And then lastly, like I was saying in my visit, is that I experienced limited solutions to managing body weights. And I wish there was effective regimens and attainable nutritional goals given to me. Like I said before, I come from a background where I grew up with an immigrant mother, so that led to me that led to me growing up in a lower socioeconomic area. So I didn't have the access to get maybe the fruits and vegetables and stuff like that doctors oftentimes tell you to get. I didn't have access to that. So I wish that there was basically deeper and culturally competent providers that knew the area that I lived in and knew of more effective ways that I can achieve that way of attaining optimal health. And then this wish list may be my wish list, but talking with other adolescents, especially people my age, I know that we all kind of agree that this is sometimes a shared experience. And I hope that there's more adolescent health advocates within healthcare to help providers go from the left side of this list to the right side. So, thank you.
I want to thank Alonzo for just going ahead and sharing his story, because of course it takes guts to get up here and talk about you and your personal life. Just to circle back around, I'm Alexia Feaster, and I'm a youth advocate with Young Invincibles. If you guys haven't had the chance to stop by our tables or speak with one of our reps, Young Invincibles is a national nonprofit, nonpartisan organization committed to amplifying the voices of young people and expanding economic opportunity for those that are 18 through 34. We also focus on supporting bills that are introduced into the Senate, along with the passing of bills that cater to the areas such as higher education, workforce development, healthcare, and others. So, me being invited here today, y'all, it took a lot because I'm a really nervous individual, so y'all bear with me. Once I got my invite, I was like super excited because I get to speak alongside these professionals who know about the whole system when it comes to wellness checks. But I was also engaged because I'm about to have a conversation with people who are interested in seeing how we can make that process even better. So, for my story, during my winter break of my first year of college, I went home. And of course, when you go home for winter break, you have so much stuff to do. So, of course, one of those things were scheduling my wellness checkup. And of course, that was super simple. I had to do it through a new provider, which was kind of sucky, but it was okay. The day of my appointment, y'all, I was shook. I was scared because I'm used to having my mama come to the appointment. So I was already kind of like under the nervous kind of spectrum as far as emotions. The day of, I completed the questionnaire, the new patient questionnaire, which is what we've been talking about. It's like 80 pages long, and they want to know like what's your deepest, darkest secrets, you know. Completed that, and I was brought to the back where I was introduced to my new provider. Now, side note, it did seem like she was super tired, but she introduced herself, and she kind of just like let me go into what I was concerned about. And during that time, another sidebar, I'm okay with sharing this because I want to be transparent. During that time, of course, I was experiencing some symptoms of prediabetes. So I was like, hey, you know, I'm experiencing extreme thirst, you know, I'm kind of dry here and there, you know. And she kind of just like nodded her head and said, okay, we can run some tests. And I'm like, okay, all right, I'm going with what the provider's saying because I'm trusting him, right? She kind of got started on my physical, which of course is just like, you know, going through the whole ear checks, eye checks, all of that. And when it came time for my blood to be drawn for those tests that she mentioned, side note, she didn't mention which test outside of the A1C. There was a nurse that came in and supported her with that. And what I felt was like an energy shift kind of made me even more uncomfortable because while she was doing my physical, it was completely silent in a sense, only asking me to kind of like breathe in, breathe out for the stethoscope and trying to figure out exactly like how my lungs and heart feel sounds. So a nurse came in, energy instantly shifted, and I felt some kind of way because I was like, well, this whole time you could have been talking to me, we could have been live, I promise you. Like, what's the problem? And at the end of that, I honestly felt like this little girl, like in my head, I felt like I was kind of low-key dismissed. I felt like I was rushed through my appointment. I felt like I didn't receive proper patient education, especially with the pre-diabetic concerns. And if given an opportunity as a youth advocate now, I will probably, suggest or advocate for patient provider protocols / expectations with FAQs to kind of like be posted everywhere in clinics and hospitals, because you never know who is walking into the door. Like myself, I'm not coming with my parent to, advocate for me, I'm advocating for myself. So using that as kind of like a speaking tool to make the visit a bit more comfortable and flowing and educate would be helpful. And before I transition back over to Dr. E, I wanted to ask you guys, in what ways or how do you think we could come up with new ways to better this process or better a wellness visit, especially for young adults? Come on, don't be shy now. Y'all in here, come on. All right, I'm gonna go with her in the bag in the purple.
Okay, as a young adult.
What? Hold on. What's your name? I'm sorry.
Okay, hi, I'm Chiamaka.
Okay.
Okay, so I feel like as a young adult, it's just, we need a little more transparency, like, with the whole process. Like, I go in, like, I don't know what to expect.
Yeah.
Like, I understand doctors are tired, and I feel like that has a lot to do with it, but like, just even sometimes the way it's like, you can tell they're kind of over it, and it's like, I just want to make sure that I'm okay. So
Yeah.
just a little bit more transparency on everyone's side, like just them coming in, like, let me know if you're tired. It would be really cool if you just tell me you're tired. I get it. I understand being tired.
Yeah.
So like I know how to like shift my expectations so that they're still being met. So just that would be helpful.
I love that. Definitely. I'm siding with you, girl, because let me know. This is your job, but if I can reschedule, that's fine too.
That's right. And I forgot to also mention there are people online too. So hi, onliners. Thanks for attending virtually. If you can't hear, let us know. But I forgot to address you guys. Sorry about that.
One of my friends is online and they're having excellent everything.
Oh, okay,
Just
they
like
can hear.
they're really texting back.
Wonderful. Thank you. Thanks for the feedback. Appreciate it. Thank you so much.
We have another question. Oh, yes.
Oh,
Yeah.
okay. I guess it's kind of like a two-parter. I would like to know more on the other side where they lacking support in, if they're understaffed or if are they being worked over hours, and also what training do they go to. I've heard a lot from my friends that are in medical school that there's been a lot of development, especially in the OBGYN department, because of the lack of like emotional intelligence, cultural intelligence, and just really like listening to all the concerns of your patient. So I don't know how involved the other aspects of health are for like pediatrics, adolescent health, and other types of like general physician health. I also think that sometimes from personal experience, I feel like if you see me for 15 minutes, that's not enough to know how I take care of myself and what other aspects outside of my life are affecting me. I've also heard from a lot of people my age that they already start to have symptoms that are normalized, and we all think, oh, it's normal, like we all go through this thing, like brain fog or like hair loss or fatigueness or things of that nature, increased weight. I think that's more normalized, and they kind of try to blame you sometimes, like, well, why are you eating right?
Right.
Well, have you used more like natural organic products? Are you getting enough sleep? But they don't ask like, why wouldn't they be able to access those types of things? Or why can't they live healthier lifestyles? Like, what are the boundaries?
Yeah. That was good. Can we give a snap for that one? I want to throw it up, and I see your hand. I want to throw that. She asked some questions. Healthcare providers in the audience. Do you mind given some feedback on that in terms of what it's like to be on the other end? Because I really feel like there's a lot of us on this side that really have the heart to want to provide the care that you guys are seeking. But I want y'all to talk about it, and then
Yeah, I have the same concerns, right? You walk into a room, you have 15 minutes or 30 minutes, it's not enough time. That's it. And we aren't in control of that. Absolutely.
Yeah.
I mean, but it's not only in a doctor's office. You know, I'm a school nurse and I have thousands of kids, you know, one me. It's just to manage it all. So, I mean, it's hard to know. Like, I think you need to have some evaluation feedback from the patient so you are aware and see how you can go about it. I mean, I just flew on a plane ride and American Airlines asked me specifically, when you got there, did the person greet you friendly? And then they asked me specific questions about my whole trip. Now, I don't know what happens with all that, but I think if you had more feedback from people, you know, I think then you could maybe put something better in place.
I like that.
You know?
I like that. Now you know there's Press-Genie out there, right? But who does Press-Genie go to? Does it go to the young people or does it go to their parent? And so sometimes it's hard to actually hear what the young people what they're doing. So I'm trying to find ways to get their voice. I saw your hand back here.
I was just gonna say, I worked with a clinic in Austin once, but they had a doctor on staff and a social worker as well as a psychiatrist, and a therapist and a counselor. Social worker, they had multiple people working all together, and so patients could see multiple people during their visit. And so even if the doctor would flag oh, they're having trouble with nutritional stuff, maybe there's something else going on socioeconomic factors, and then would have them meet the social worker before they left in order to try and help with that. So I feel like
Yes, very much.
Interdisciplinary care. We do that here at People's. So that's a good idea and good suggestion. And the hope is that there are more models like that kind of spread. I saw your hand there.
So another interesting take for me is, so I've been in the States for a minute, but I'm very reluctant to schedule a wellness. Well, first let's start with I'm completely oblivious to these things, right? So
and where you said where are you new from? Where do you mind sharing where you came from to this?
France. So French.
Okay.
And so what happens is I am understanding. Mind you, I was born here. I was just raised, outside of the country. So then you come here, and then it's well, I don't want to schedule a wellness check because the general consensus is you have these resources, but how are they marketed, right? So it's oh my God, don't go to the doctors. That's going to cost them an arm and a leg. And so people don't know because I can tell you, I sit down sometimes and I'm okay, well, I could have cancer and I don't even know. But I'm not going to go to the doctor though. I'm going to find it out when I'm at stage 4. Because I don't know. My grandma recently made a comment you're a freaking, you use the restroom frequently. That's signs of diabetes. And I'm but I'm not going to hospital. So it's how part of the healthcare system, and then also that's one factor. The other factor, which she touched on, is these providers. What are their conditions? Because they're highly paid. That's all I hear from healthcare providers, that they're highly paid, and so then it's they have all these responsibilities. It's hard to expect so much from them because you come with this preconceived notion that they have all these responsibilities. Yeah. I haven't been to the doctors in forever. And so I honestly didn't. I
appreciate that
transparency. So it's how is this getting out there? I didn't know that, checkups are something that's frequent.
I think it goes back to you all's first question. So you asked about access. How can we increase access for young people to even think that a wellness visit, is something that they should consider? And for you as a parent, how can I prepare them for that? Just looking at our time, I'll talk about one option for innovation, okay, that we're doing at CYCC. For mom or parents in here, take this. For parents, when you look at this table, I know it's here, but when you bring your babies to their well check, somehow that's expected, right? But do you know why that's expected? Yeah, it's shots, right? So it's an idea that I'm going to the healthcare facility because they're going to give my baby shots, but there's less of an emphasis on, oh, I'm going to learn tips on how to raise my baby holistically, right? And mind you, that's also a function of like the timing of the visits as well too, and being able to give that education, patient education, as Lexi was mentioning. But I think it does start with us as a healthcare provider providing almost like a guideline to say, this is what to expect at this age. But then before your next visit, these are the things to consider so that you have almost like an incentive to want to come back and say, remember we talked about my baby was supposed to be walking at this time? They actually did it. Or, oh no, they didn't. But I don't want us to forget that adolescents and young adults have milestones too. So that's one of the things that we do at CYCC is talk about milestones, that milestones don't end at age 5 or kindergarten. They kind of go throughout. And so, and it's really related to how you're going to be an adult. Like, how do you manage your body? How do you manage what you eat? Because you have to eat. But what we're seeing is that you're either eating unhealthy, too much, or too little. And somehow when we talk about obesity or trying to prevent obesity, we have to be careful as healthcare providers how we have that conversation so we don't drive people into guilt and then they come to us with eating disorders. So it's one of that like fine balance is like how to really have these conversations that talk about what you have to do, naturally, but then how to be self-aware, to moderate, to monitor, and to track your behaviors. And so you're looking at this handout. It's called Center Groups. So for me, just looking at the time here, and we'll get more questions, especially in the virtual world. If you have any questions, feel free to put in the chat. But I had this idea to start a youth clinic almost like 11 years ago when I was in fellowship. So I trained as a pediatric resident. I felt like I really wasn't supposed to be a doctor. I should have been a social worker in my real life. But then my mentor, who was a social worker, said, no, stay in medicine because we probably need some of those messages to be propagated through healthcare. And now we're talking about what? Social determinants of health. And the social was like, we've been talking about this like in eons ago, right? So she said, stay here. So I said, okay. I looked for a field that allowed me to talk about the biopsychosocial aspects of health, and adolescent medicine for me fit that. So I did a fellowship, and during my fellowship, I would go in clinic and see patients. And then on the weekends, as I mentioned, I was a church youth ministries director, and I would have like generations of high school students work with me every weekend. And I found like there was a discrepancy in terms of the individual young people that I was seeing in my clinic versus the group of young people that I would talk to at church. And I can't tell you how many deep conversations we would have in these groups compared to me saying the same thing to 10 young people in one day for a well check. Are y'all feeling me so far? And so when I thought about like, well, if I'm gonna do anything related to healthcare and continue to like improve the health of young people, like how can I bridge those two worlds, right? Thinking about groups for patient education, but then also making sure that we don't miss the individual young people. And so Centering Healthcare Institute, I'm not sure you guys, are y'all familiar with that at all? Anyone heard of Centering Healthcare? Centering Parenting, Centering Pregnancy. Yeah, so they are nationally recognized and they have shown evidence where if you encourage, and so this is answering your question in terms of like, how can we increase access or improve the likelihood that people will be interested in well checks for adolescents? The Centering Healthcare Institute looked at moms who were at a certain trimester and invited a group of them to do their visits together in a cohort. So that's Centering Pregnancy. And they found that those groups compared to those who just had their individual well checks, their pregnancy checkups by themselves, those who were in cohorts had better outcomes in their delivery rates, less preterm delivery, less complications during pregnancy. And they found that it was one, peer learning. So someone mentioned about socioeconomic contextual things. It's one thing for us as healthcare providers to think that we can impart all this knowledge to each of our patients, but there's so much shared learning within communities that we miss out on because it's about context, right? It's about context. And so sometimes, so in these groups for Century in Pregnancy and Century in Parenting, they found that the outcomes were helpful because of the cohorts. So I pitched to the CEO of Century Healthcare. I said, I think this is helpful. This could be helpful for teens. Why? Developmentally, what do young people like to do? Hang out with their friends. Like, hang out with the friends. If there's a party going on, it's not, oh, is this your party? No, it's like, who's going to that party, right? I want to be where the action is. And so what I was trying to do, and what they're allowing us to do, they're giving us 2 years of support to be able to get young people together to learn some of these lifestyle skills. So if you go to the next slide, and then we'll close out a bit. This is somewhat my motivation for why I started Centered Youth Clinic, is to say all these chronic diseases that are in the population, majority of them have modifiable risk factors that we can address. Like we know, like, and mind you, there are definitely genetic things, right? There are things related to socioeconomic status, but it's like, how do you match that, but still look at the individual's ability to feel empowered in how they manage their health? But one of the things, how many of y'all, like Jenny Craig or any of these like weight loss programs, do you ever see them do them by themselves? No, everyone is joining a group. There's a group that they're joining. And so what we're doing is we have 2 groups called Centered Bodies and Centered Cycles. Right now we're looking at Centered Bodies, where it's about how you manage your what you eat. So interdisciplinary care, we have a nutritionist who's on board. He teaches these young people all about food, like being able to look at labels, reading labels, but then having field trips where we go to the grocery store and we say, oh, if you're gonna recommend, you may not necessarily have the buying power, but if you're going shopping with your parents, like how do you feel empowered to say, hey, I actually wanna try this? Having the courage to do that, but doing it with support, because then you see some of your friends are doing it, and it encourages you to do it. So that's nutrition. Physical activity, we have a chiropractor, physical therapist who also helps teach some of these skills. Like, yeah, you want to work out, but how do you do it safely, right? And then there's a prescription that there's evidence to show there's a certain number of hours that you need to work out for you to be able to see outcomes, right? How do we teach that to young people? Not just, oh, I've done 3 sit-ups, now I'm ready to go, right? But it's like, how do we kind of infuse evidence with practical application? And then how do you manage your mind? So we have a licensed clinical social worker who also is there to talk about like moods, mood management, anxiety, and going through that. And then my role is reflection. So going through medicine is do, right? But it's like, I think we don't teach our young people enough to pause and stop and reflect. I'm gonna stop for a little bit. Stopping and reflecting. Because sometimes it's like you may have a to-do list of, okay, I'm gonna eat 5 servings of fruits and vegetables, right? Or I'm gonna do all these, and then the 2 days that you don't do it, what happens? You lose you lose motivation. And then the question is like, well, how do I plan ahead to be able to say, I know that these are gonna be my triggers that will get in the way of my goals, but how do I pause and think about it ahead of time so that when it happens, I've already prepared for it, right? So for me, it's teaching them how you pause and reflect so that whatever goals you have a plan for it. I'm gonna have Alexis, she's my MA, because talking about the setting, we're almost there. Talking about the setting, because it's a 15-minute visit right now for wall checks. And we use that to invite young people to come into these groups for our center groups. But I think it's really important for us when we think about questionnaires, like how do we simplify that process so they're not coming and spending majority of their visit time in the clinical setting. And so some of the things that we do at Centered Youth, I was gonna have Alexis kind of give a brief overview of that.
Yeah, so at our clinic, we try to make things as modern as possible so it's easy and accessible for a lot of people in different ways. So what we do for these screening forms, that we screen for anxiety, depression, and we do that for anyone who comes in for behavioral visits. We do that every 2 weeks. And so with that, we send a link through their email and they're able to get to it. We usually send it the night before their appointment. That way they have adequate time to get to it. They can do it on their own time. It's not taking up time off of their appointment so that when they get to the clinic, I can just say, hey, let's go back there. Okay, I'll get your vitals and we can just talk to the doctor. It's not taking up the time that they're supposed to be addressing issues in their life and in their health with the doctor.
Thank you. And to that point, yes, a lot of us are overworked at times during the visit. So a young person may fill out that survey, but by the time they get to us in the back for us to see them as a provider, we may not have had time to even look at that paper, to be able to even ask follow-up questions. So the questions like, how can we, again, give them ample time to really look at those? So the questions we're passing around, that's RAPS, risk assessment for adolescents and preventive services. Those questions, like, the young people can think a little bit more about answering it, and then by the time we get there, we've reviewed some of those responses. So when they're coming, we're prepared, right? We're prepared to some degree, but it takes innovation. Like People's has RAPS here, not every place has RAPS. And I'm saying RAPS, you guys know that it's part of the screening, like it's a screening questionnaire that was modified based on Bright Futures and the USPST, I never can say that, but the United States Preventive Task Force. And so they try to make it easier, and it's on the link so they can watch it on their iPads, and it's in different languages, and they can be able to answer the questions, and it's engaging. And what I love about RAPS at the end is that it asks the young person, well, what else do you want to learn about your health? What topics would you like to learn? And they send messages throughout like you get to choose the frequency sometimes, if it's once a week or once a month, but they learn more information about certain health topics that they also want to know. So that's kind of what we're trying to see, is like we're sharing what the current standards are. The young people have shared their experiences and some suggestions, and we've heard from you all as well too, in terms of how we can rethink wellness visits, but it really takes grassroots effort for more people to really kind of blow the horn and say, hey, something else needs to happen, because our population is not getting any healthier. So how do we redesign how we deliver care to young people, and how do we do that in concert with interdisciplinary care, empowering our young people's parents and caregivers to prepare them ahead of time? But sometimes, the parents also need to know what to expect. So how do we make time to be able to do that? But that's all we had for ours. And then I think the last slide just kind of has like the key points. Standard resources, engaging youth perspectives, and then thinking about innovative ways to teach lifestyle behaviors. It's not enough to say what to do, but it's like, how do you do it, and how do you plan for, barriers to your goals? I think that's it.
Thank you, everyone, for such a wonderful session. Again, thank you so much to our speakers. I just want to, again, take a second to highlight the amazing work that y'all are doing, and thank you so much for sharing all of that with us. Sorry for the in and out the whole time. We are in transition for the next sessions that will start in a minute, fairly quickly. So if you're staying down here, this is where do youth get healthcare information on social media. Upstairs is supporting peers in navigating difficult conversations while setting barriers. So choose your place to be. We started shortly. And sorry to rush, but I just wanted